Today's update, just quickly, this is where we stand as of Monday, August the 23rd. And as we spoke last week, our commitment to you is on a weekly basis, we'll provide this information or provide a live update. So first of all, it's just important to know that we have 282 patients that are hospitalized this morning with COVID. That includes 9 that that fall into the category of pediatric. Also, just so you know, we've been tracking the percentage who are not vaccinated. So 91% of that number of inpatients of the 282 are unvaccinated. So again, this just reinforces what we've been saying for the last handful of weeks, which is the vaccine is protective. It may not completely prevent somebody that's vaccinated from actually developing COVID, but it sure seems to keep people from getting significantly ill enough to require hospitalization. And our data continues to reaffirm that assumption. The average age of the hospital patient is 55, as you can see, and the graphic that we're rolling down to now just shows you where we are relative to our admissions. And this is actually a graphic that's 1 week behind. We just the numbers today it's been updated. It's 282. So we're getting closer to that 309 peak that we experienced back in January. So a couple other things that I will just point out is this is the trend that you're seeing in terms of the number of hospitalizations compared to last summer, and it's a pretty significant difference. What we also are following or attempting to follow is looking at our daily admissions versus our daily discharges for patients that are diagnosed with COVID, and that number over the last 3 days has actually been, we've discharged more folks from the hospital than we actually admitted with the diagnosis of COVID. And that is an important trend. Hopefully we will continue to see that trend, because if we do, that'll be the sort of leading indicator that we will begin to peak out in terms of the number of admissions. Some of the other data points that I wanted to share, things that have been asked in the past, we'll make available to you. As of today, we had 119 of our employees that have tested positive for COVID. So we have 153 total that are out, and I'll run through the numbers. Of those, 119 have tested positive for COVID. There's 1 pending. We have 13 employees that are in quarantine because of positive household members. And so per the CDC guidelines, they are not at work. We have 21 individuals that have other symptoms but tested negative for COVID. So as we've talked before, there are other viruses, other respiratory illnesses that still are making their way around the community, and we have a handful of our employees that have been out. Other things, just testing data, so you know, we did a total of 5,724 tests in this past week. That's up about 100 from the week prior. Our positivity rate coming out of our lab was 22.4%. That's actually a little bit less. It was 24% in the week prior. The one other thing before I turn it over to Christy and ask her to provide you some insights from inside the hospital, I did want to mention that we are ramping up to be prepared to deliver vaccine booster shots to our staff. Obviously, a week ago, we learned that there was approval for a 3rd shot for those patients that were immunocompromised. Now with the FDA's approval of the Pfizer vaccine and the recommendation that those of us that are vaccinated should receive a booster at some point in the not too distant future, St. Francis Health System is in the process of preparing to not only vaccinate our employees, but then ultimately those in the community that are obviously interested in and due for a booster. So I'm going to stop there and introduce Christy Christopher as one of our nurse leaders. She's actually been with the health system, my understanding is about 20 years. And we've asked her to join the conversation this morning to provide you some insight, firsthand insight from inside our St. Francis Hospital.
Hello.
And we can hear, there you are. Hi, Christy.
Hello. Thank you so much for the chance to be here and to have a chance to share with you a little bit about what is going on the inside of the hospital. I think we see so much on the news that we lose a little bit of the humanity and the compassion and the struggle that is actually happening in our walls. Just to tell you a little bit about myself, I am a director, but I have responsibility of supporting all of the adult inpatient units here at St. Francis. And just to give you a scope, 200 patients are being cared for COVID out of 800 hospital adult beds. So that would be around 25% of all of our capacity is being dedicated and realigned in order to take care of the COVID patient. And that is not a small feat. The patients that are here with COVID, it's a challenging population because of how sick they can be, as well as the isolation and the amount of emotional toll that is on the patient and on the staff. So to sum up how we feel, it is actually very overwhelming, and we are doing the very best we can to stay resilient and positive with our staff. We have 3 different levels of care that we provide for the COVID patient, one of which is where you are sick enough to need the hospital. And we kind of joke in nurse life that we don't know what sick looks like in the community because you're not sick until you need a hospital bed. But we have a lot of patients that are requiring hospitalization for COVID, mostly for oxygen needs, also for antibiotics and fluids. And the staff on those units, even though that would be the least critical of our team of nurses, those patients, you can't underestimate the stress that's going on in those rooms. And patients that feel like they can't breathe, that's a very difficult experience to be with the patient in that kind of setting. So we're telling them we're trying everything we can to pause this where it's at and help them get out of the hospital as soon as possible. This wave of Delta that we're seeing this time feels very different than last January. Our patients are much younger, and something anecdotally we've noticed is they fail faster. So a patient can start out just needing oxygen at the beginning of the shift, and by the end of shift can be on what we call high flow oxygen, requiring a lot of support, and possibly be on a ventilator by the next day. So the speed and the progression at which these patients have struggled is actually very shocking and sad, hard. So the next level of care we have is where we actually provide oxygen at a level where it's an external ventilator forcing the air into the patient's chest. And at that point, we really, as nurses, they're dependent for us to provide them all their care, but we're also trying to preserve the fact that they can communicate, and we're trying to connect them with their families. We're facilitating FaceTime visits. We are listening to conversations and helping patients as they talk to their families, possibly with the fear that that could be some of their last words or conversations. We even have patients who are making sure their affairs are in order. And I don't say that to scare you, but that's the point at which the patient can have a conversation. And we're reassuring them and trying everything we can, the entire team, in order to help them avoid being ill enough to go on a ventilator. We don't have any control over where it goes. We need to be ready to take care of the patient as they change. But yeah, our entire goal is to keep the patient off the ventilator and to stabilize them. There's another level that comes after that, which would be our critical care level. And I have witnessed to that personally. I care for the team that is the COVID ICU right now. And it's the most stressful I've ever seen on our staff space. And the heaviness that they're carrying, equally, they are brave, courageous, smart, and providing the hope that they know they can provide for this family. We are very much every day having conversations with families about updates, but the critical care age of the patient, we have patients that are in their 18, 20s, 30s, 40s, 50s, and I would tell you that is completely not normal for an intensive care unit. We are not used to seeing patients that look like us. When I say us, meaning the age of my staff member. The last wave, we really saw patients that were a lot older. And this wave, we're seeing a lot younger patients. And that truly is shaking my staff. We're doing everything we can to help these patients. But there is a lot of death that these nurses are facing. And they are in a battle against it every day. And that's what we're doing. I came in last Wednesday, just to give you a snapshot of a day, and was immediately facing nurses that had fought all night to try to save, obviously, every patient on our team, but one in particular was standing out to them as hard. It was a 36-year-old father, and I quickly was headed off to the next meeting, but had to take time to listen to that nurse know that she tried everything she could, and the patient was obviously still alive at the end of the shift, but we were very, very concerned he wasn't going to make it through the day. And as I head down the hallway, I walk by our waiting room, and there is a 10 and 11-year-old children in our waiting room, and that was their dad. And so what we're facing is not just the fact that our patients are fighting for their lives. The patients are young, and we are trying, it's just a whole nother burden of preparing patients who are this young to potentially lose their life. And the patients are comfortable, we're doing our best to keep them comfortable. It's really connecting with the families and the nursing staff doing their very best to help that family understand what we're doing and also the progression of how their family member is doing. We unfortunately, that patient did pass away, and I learned today that the wife of that patient also lost her mother on one of our other ICUs. So the impact to the family is, you just can't underestimate it. So it's something we are here for. This is what we do. We take care of anything in front of us, regardless of what got the patient into our hospital. But I was trained as a critical care nurse. I am used to having success. I am used to having more success than I'm seeing right now with COVID. My nurses are doing the absolute best they can, and that's happening at all of our sites. That's happening in each of our critical care units at each of our hospitals. Today, we lost one of our nurses' husbands, and this story is just going to keep repeating itself until we're able to get through this. There's fear up here about what the future looks like as if we can't slow this down. And my plea would be to the community to please partner with us to help slow this down. We feel that obviously the best way to prepare your body to be ready to fight COVID, because we feel it's not a matter of if you see COVID, it's when you see COVID. We believe vaccination is the strongest way that it prepares your body to be ready to fight COVID. In the meantime, though, I would plead with you to consider helping us flatten this curve. I know we've heard those words before, but using the tool of a mask to protect the patients that are not vaccinated, as well as the patients that we know are more immunocompromised or their weakened immune system. As a community, we need to slow this down so that we can help take care of all the patients that are asking for and needing our care right now. I would ask that you speak with your doctor if you have any questions and concerns. But for the nursing staff, the conversation we've had up here is, it is just not normal, completely not normal to have a 20-year-old, 30-year-old, 40-year-old, 50-year-old, a unit full of that age on a ventilator. The times that we do see that are patients that usually have been involved in an accident or some sort of trauma. And we understand that that comes with sometimes the being at the wrong place at the wrong time, which we think COVID admissions, some of our patients got exposed and didn't realize it, of course. But also we have some patients that, the analogy being that if I were in a motor vehicle accident, a car accident, and weren't wearing my seatbelt and were ejected and were critically ill, I would have a part in that because I chose not to wear my seatbelt. So I would ask that if you're even on the fence at all about considering vaccination, please consider being vaccinated today. Please ask the right questions of your health professional, but that would mean a lot to us to try to keep you out of our hospital. If you interact with a nurse, I would ask that please don't be dismissive of what this is for us, because whether you're on the front lines of a COVID unit or you are in any of our units that are supporting the patients that need to be in our hospital, what we're experiencing is very real and it's very personal. And we are absolutely going to be here for you. We're going to figure it out. We're going to take care of our team. But our team is having to work above and beyond their normal responsibilities just to maintain what we're doing today, which it's still an incredibly stressful experience. We are trying our very best to support our staff and help them be as successful as we can and supportive to our families to show them the compassion and care that we want to give.
Thanks, Christy. Just a quick question before we open it up for questions. Could you talk a little bit about the teamwork and what you see in terms of, staff, nurses supporting nurses, doctors and nurses supporting each other? You might just spend 30 seconds just describing what that looks like inside the walls of one of our hospitals.
Absolutely. So it is a team sport. No one discipline cares for the patients. There's many hands, many minds working together. We are equally supporting each other to help care for the patient. The nurse might be the eyes and the ears, but the physician, we are going to follow through with everything they say. But respiratory therapy, nurse techs, phlebotomists, even our housekeeping staff, and anyone that is a part of our team, we could not do this without every single person. And I would tell us as a whole, don't give up, keep coming to work, and we will get through this together. The team is absolutely caring for each other as well. We are having to debrief after we've had rough shifts, and we are helping each other understand that we're doing the best we can with what we have, and we're going to keep showing up in order to do the best we can.
Yeah, thank you. One of the things that I've noticed, and I'd be interested in your reaction, is it's a little different this time because than the January surge that we went through, because the community support is different. It's not the same, right? It's like everybody's moved on, and yet we've got thousands of caregivers that make up the St. Francis Health System that are still dealing with COVID on a daily basis. So talk a little bit about how that feels, how different it feels this time in that regard.
I think that's a huge part of how this is actually much more stressful, because we're in these walls every day facing the giant that we are facing like we did in January. But then when we leave these walls, the community feels like life is back to normal. And the reality is that we're not going to crumble, but we are carrying a lot on our shoulders. And it feels as if the community isn't necessarily doing the things that we were doing back in January, such as masking and social distancing, in order to help slow this down. And my fear personally is that there's not an ice storm coming our way in the next 2 weeks that's going to cause our community to essentially go into their homes and not spread. I by no means am asking to close down. I'm just saying I don't know how we will, without masking and increased vaccination rates, get out of this without the public partnering with us in order to slow the spread. Wear masks, consider vaccination, do both at the same time, and hopefully, that will get us through.
Thanks. Lauren, I think we can just open it up for questions, however you want to navigate the next part.
Yes, we can open it up to the group, please, one at a time. And if you would prefer to message your questions to the host, you can do that as well.
Hi, Christy. Rick Marinon at Fox 23. I was speaking with an OU doctor last week, and he put out a plea saying, drive safely. We don't know if you get in a car accident if we have a bed for you. Is that true for St. Francis? Do you have a bed for me if I'm not a COVID patient? And if so, am I going to be in bed next to a COVID patient, increasing my risk? Thank you.
Thank you for the question. So the reality is we will take care of you. We will find a bed. The wait for that bed is going to be much longer than expected. So for instance, today, part of our critical care unit that cares for trauma patients is also caring for COVID patients. And I think I have no less than 4 patients that have arrived in the last day that are waiting in line for the next available bed. We work very hard every day to get the patient to the right level of care, which means as patients improve, we move them out in order to make room for the next patient. But there's always a waiting list for nearly every bed we have, whether it be a COVID bed or another type of bed. So we work very hard at the hospital to try to be as efficient as we can. And also, while we wait, take the best care of the patient so that they're still safe in our care.
Hey,
I'll add just one thing to that. What's a little bit different about what we're dealing with COVID is the COVID patients tend to stay in the hospital on average longer than what you might see for another respiratory illness. And so Christy's point is, while we may have 80 or 100 patients that are discharged from the hospital today, we do have patients that are in our emergency departments or somewhere in the region in another hospital that need to be transferred to St. Francis. And we've got a team of skilled professionals that are just, they're air traffic control, quite frankly. They're navigating how to make sure patients get the care they need in the most expeditious manner possible. But the situation we find ourselves in today, that does mean that there are some patients in our emergency room as we speak that are being admitted to the hospital, but aren't being moved upstairs to a bed just yet because that bed, there's still somebody in it who's going home later today, and will ultimately, there'll be an overlap where there'll be some time where the patient in the emergency room will be staying in the emergency room until a bed frees up for them upstairs. That's not atypical, meaning busy hospitals, busy health systems like St. Francis deal with that situation on a year-round basis. It's just a little bit more hectic these days because there's such a need for hospitalization, and the folks our professionals like Christy, spend much of their day making sure that patients are cared for appropriately, even though we have more demand than we might have capacity at any given moment.
Vincent Hill from Channel 2. You mentioned 91% of the COVID patients are not vaccinated. Two-part question. Once they're admitted, are they asking to be vaccinated? And with the new approval for Pfizer, do you expect vaccinations to go up? And the last part of that vaccination question, of your employees that are sick with COVID right now, have they been vaccinated in the past?
So let me answer the second part first, which is the answer is that is yes. About a third of those patients that we've said are out with COVID are fully vaccinated. Patients, employees have been fully vaccinated, and that number has been relatively stable as a proportion. We don't have 100% of our employees vaccinated for a whole host of reasons. That is something we're working on, as is every health system in the country. To your question about the 91%, the folks that are admitted that haven't been vaccinated, I'll let Christy speak to the specific cases that she's aware of. But yes, anecdotally, we definitely hear family members and patients, ask about being vaccinated when they're admitted. And unfortunately, at that point, it's too late. The vaccine wouldn't help them in any way and wouldn't be indicated while they're acutely ill. Christy, I don't know what you can share just from your own experience.
I was just rounding with the nurses today, and they were mentioning about how patients are asking or wishing that they had been vaccinated, not really understanding what it's like to be a patient and require this much support and assistance, as well as the fear of their risk of losing their life to COVID. So not every patient feels that way, and we respect we're going to care for them no matter where they are on that idea spectrum, but we definitely do have patients prior to intubation, especially, or when they're struggling to breathe, that are verbalizing they wish they had had the vaccine.
As far as we do expect now that there's been formal FDA approval for the Pfizer vaccine, we do expect that will, we hope that will encourage folks that might have been on the fence to go ahead and get vaccinated now. We'll see how that plays out over the next few weeks, but that is our hope.
May I add that we started offering vaccination to our discharge patients. If a patient has expressed while they're here at the hospital that they would like to have a vaccine, and that's in alignment with what their physician believes with the care that they're receiving already, then at discharge, we're able to offer them a vaccine on their way out.
Thank you. Any other questions?
Rick Marin on Fox 23 again. Do you have enough ventilators, and are you ordering more? Are they on the FedEx truck as we're talking right now?
So right now we have enough ventilators. The team of which Christy is a part of is constantly looking at our resource utilization for and what we think will be needed not only tomorrow but 5 days from now, a week from now, as that is just good practice. They do that all year round. That isn't something unique to COVID. But yes, I can tell you that our incident command folks, our leadership here that manage the day-to-day nuances of COVID care have in fact reached out to make sure that we've got an additional stock of ventilators should we need them. We're nowhere close to needing them as of today, but think if this trend continues over the next 5 to 7 days, that's what the team is preparing for and planning for.
Because of your current bed situation, are you telling other hospitals and things, don't send your patients here, we need all our stuff? Or have you even had to send somebody out of the region or state because you did run out of a bed?
So last week somebody asked a question and I wasn't aware. Apparently there has been a very rare situation where either patients from an outlying hospital were wanting to be transferred into Tulsa, into St. Francis, that we couldn't accommodate, and they were instead transferred to a higher level of care somewhere else, somewhere outside of Tulsa. So that has occurred, but it's been very rare. And I have been made aware there's been at least a couple of occasions where a patient had a specific set of needs that we couldn't accommodate in a short order of time, and that those patients were then transferred out away from St. Francis to another hospital, another community. So that has occurred. As again, this is not that dissimilar to what goes on every day when even before COVID existed, but it is definitely more of a concern today, particularly in this region of the state where we've seen quite an increase in the number of patients needing hospital support. So that does occur, but it isn't something that's completely unusual.
The only thing I would add would be that we're in contact with our system other hospitals, Muskogee, South, Veneta, and what they feel they cannot, that would need to come to the Yale campus. We work to try to be sure we know who those patients are and work on a plan to get that patient to the safest place possible.
And Christy, as a piece that I didn't answer, but the question about, if you're in the hospital for another reason, are you going to be, next to somebody that's got COVID? Could you talk a little bit about the work you've done, you've led to cohort patients so that folks outside the hospital understand how you're managing these patients?
Right. So our primary goal would be that there's a team of patients and a team of nurses in a location of the hospital where we've been able to even alter some of the airflow to make it as safe as possible for the staff as well as the patient. We do try to cohort all of our COVID patients together. That's not absolutely 100% able to be done each day, but I do have negative pressure rooms, which is the kind of isolation a patient would need to be in, scattered through the hospital. What I would tell you is that you might be next to a patient that would be in a special room for the isolation, but we're also protecting ourselves with personal protective equipment. And we are going to be sure we use all of our proper hygiene and protocols in order to keep any patient we care for safe. But yeah, most of my COVID patients, we've been able to cohort. We have actually COVID on 7 units right now. And most of those are exclusively COVID.
Thanks.
I hope I answered the question.
Yeah, thanks. That was great. Any other questions?
I'll ask one. This is Kelsey with the Tulsa World. And Cliff, I know you kind of mentioned this earlier, but do you expect to surpass the January peak? And if so, how soon?
If you look at that graphic, the trend line looks like we're going to meet that 300 threshold, if not exceed it. The only data point that I would say gives me at least some hope, temporary hope, that we won't exceed the January peak is that if you look at the number of patients that are admitted with COVID on a daily basis, and I net that against the number of patients that were COVID patients that were well enough to go home, the last 3 days, so through the course of this weekend, we admitted fewer patients than we discharged. So that is that's a great sign. That's only 3 days, so we need 7, 8, 9 days in a row in that manner before I think we would start to see a true plateau. But that data point and the fact that we saw a little bit of a decline in our test positivity rate are both data points that give us a little bit of hope. I would tell you that the team is prepared though for just to continue the trend that we're on, because that seems to be more probable than not that we'll continue to need to take care of an ever increasing number of COVID patients. The one thing you haven't asked that I'll just comment on, we were asked last week, but we are looking at our surgery schedule, procedure schedule that is being managed day to day, because we do recognize that if we need to create additional capacity, one of the levers that we can pull is to do fewer procedures and try to redivert those resources, human resources actually, to care for COVID patients. What we learned the first go around was that stopping surgery didn't really create as much capacity as we would have thought a year ago, and more importantly, delayed a lot of care, which we worry doing that again is probably not in the best interest of our community and of our patients. And so we're trying to be very thoughtful every day, make decisions around what procedures we need to continue to perform versus what things we might be able to push back for a week or two without any ill effect on the patient. So that's happening daily. And it really is a day-by-day management function.
Thank you, Cliff and Christy. If there aren't any other questions, we will end the call. And if you do have follow-ups, you can contact myself or Savan via email or through the office. Thank
And
you.
I'll just close by saying Christy touched on it a little bit, but it is amazing work that is being done by thousands of clinical staff, of caregivers that make up the St. Francis Health System. And I would just encourage those of you in the public to, when you see a nurse in the store, or if one of your neighbors works in healthcare, to just take a minute to say thanks to them, and let them know that you're there for them, and you can do whatever you can do to support them, because this is a trying time. And as I said earlier, we continue to be in the throes of COVID while the rest of the community is sort of moving forward in a more normal manner, and that is, I think that puts some extra sort of stress on our teams. And so don't forget to thank a caregiver.
Would it be okay if I publicly say thank you to all of our staff, our nurses, our techs, our physicians, our respiratory therapists, our radiologists, anyone who touches our patients? I genuinely say thank you, because we could not do this without you. And we are going to get through this. We are going to figure it out. And we appreciate so very much how you are Christ's hands extended, living the ministry of what we do here at St. Francis. So thank you.